So the project originally was brought about to look at population health needs for Selby Town, but it was to establish some principles about how we might understand our populations and then work together really to make a difference in people's lives, certainly to improve health, but from like an early intervention position. We're also looking at how we can engage patients more. So patient insight is not just about going to them and asking them how was this service. It's changing the question and saying, what can this service do for you? What in your life could be made better through working differently?
The questionnaire that was developed really focused on those wider issues, so not just about preventing ill health. It was looking at what are the barriers to them accessing support and services. What we're hoping is that we can really use that to look at services in a different way. So there's lots of organisations round the tables. We've got GPs and we've got commissioners of services, and we've also got providers of services. So can we use that information that we've got now from this cohort to really look at services in a different way? Can we redesign them completely, or can we just tweak services to meet the needs of the cohort and the feedback that they're giving us?
It was absolutely going to be around the holistic needs of a patient, health in its much wider sense, much more around well-being and what really matters to people, not what a GP or a nurse might perceive matters to them.
Working with patients and individuals in the groups that you're trying to target and trying to make improvements for, getting them involved in co-design is a really different way of involving people, and also hopefully will mean that we get better outcomes for patients in the services they're shaping.
It's taught us to think about our population in a completely different way, where previously we would just focus on very narrow practice-based registered lists, and primarily our focus would be on the people who thought they needed to see us for whatever reason, and we dealt with those, and that's really all we ever did. Now we're beginning to think about our population need in a completely different way, in terms of anticipating need, not necessarily for the people who come to see us, although that's still important, but the people who don't come to see us, and how can we address their need before they develop a crisis or a problem that needs our help.
How keen and how excited some of our patients were about actually helping to co-design this, and the fact that practices and people running services contacting patients and asking them what they thought was a really novel approach for a lot of people, and they've been really excited about the opportunity to help shape that.
One bit of feedback we had from the patients themselves was that they enjoyed that we contacted them rather than them having to ring the GP for anything. So we found it was quite a proactive process rather than the usual reactive involvement that we would have with patients.
Certainly one strong piece of feedback in these early days is that welcome reach out from GPs and the surgeries.
The difference that this has made, the project has made to the way that we'll work is, I think it's allowed us to appreciate and value listening to patients and their responses. It's given us confidence to work with external partners and really enjoy joint working. And I think we've enjoyed and learned that it's really nice to have the opportunity to reach out to patients. So it's a much more proactive way of working.
What was really interesting, I thought, was that nobody said, I want more tablets, or I want to see my doctor more. What they wanted, and what turns out is much more important to them, are connections, social connections, activities, I guess a sense of belonging, rather than more prescriptions and more tablets. So again, it kind of forces general practice to think about health and well-being, not just about reacting to illness, but promoting health and well-being, which we've never been good at before.
Having to work with 50,000 people, you can't reach out to them all, but actually doing some intelligence-led work to reach out to just a small cohort of people is giving us all enough understanding to think how we can work with that wider group. The population health management programme has given time and space to think about how you can make a difference. The programme allows you just to take a step back, use the strength of your partners, and question how you can move forward.
What was most different for me was the role in the sort of population health management of using that stratified data. So I'm looking at populations by segments in terms of demographic sort of factors, as well as health use, and using a linked data set that brought together information from a number of different places, gave us a really different lens into where we should be targeting our support. I think probably one of the other things for me is a recognition of the time that this takes. This has been a relatively long journey in a world where we're usually pushed to go very fast in terms of doing things. But by taking time, by properly thinking through what we're trying to achieve, and importantly then going out and talking to the people that it'll affect, thinking about how we get more of a sort of co-produced approach with the local communities, and recognising that the assumptions we might make about individuals and their kind of needs and goals probably don't reflect realities.
It's not all about a clinical intervention, it's about a community intervention. It's all about that grassroots activity playing a key role in a big picture issue around people's health and well-being, and seeing that valued by clinicians, public health people, local authority people was a real light bulb moment for me. It made me realise that population health management approaches could be really quite transformational.
In terms of what the project has delivered for us, we've had a lot of good feedback from the patients. We've learnt about them and what kind of services they want, and what's come about from the discussions is that they would actually like more services in the area relating to education and things that aren't just exercise based, so going to a gym if you want to lose weight. They would actually quite like more of the background to healthy eating and help them sustain that as a long-term thing. So it's a much more holistic approach to their healthcare.
It's a great opportunity for joint working and building relationships for any future projects and work. It enables you to structure and shape services. I think if other PCNs were to be involved, it not only helps the PCNs but helps the community and empowers patients to take part in their own health and new projects, and it allows patients to adapt their services within their own community. And I think what is nice about being part of a PHM project is it helps create accessible services for all. So we're looking at adapting the traditional services and looking at tailoring new and more accessible services for all.